Everyone's cancer journey begins differently. For some, the journey begins with 3 words no one wants to hear. You have cancer. For others, it begins with a suspicion something doesn't feel right. From diagnosis through treatment, medical challenges, and beyond, regardless when the journey starts or the path it takes, individuals diagnosed with cancer are supported and cared for by oncology nurses every step of the way.
Oncology is a beautiful field. The positive impact that a nurse can make on the patient, whether it's through the treatment or in their final days, and then for the family in the long run, it's something that is rewarding and fulfilling in ways that I can't even explain.
Compassion is the #1 thing that we need to have with our patients, because they're going through such difficult times. And in any profession, it's very easy to become desensitized because you see things on a regular basis. But that's the one thing I've always said. The day that I can't be compassionate or I can't care is the day I don't belong here.
I love caring for the patients. I love the feedback that you get from the oncology patients here, because they need you. And again, it's giving a part of yourself to them to help them, because they're so sick here. I've learned so much about myself and what I can give to others and serving others through this job here. And it gives me a sense of purpose, and that's why I love it.
I have a lot of favorite parts of being an oncology nurse. First, I get to be in a specialty in nursing, and I have a lot of opportunities to learn more and grow more. And it kind of funnels into this little specialty that you can learn so much because you're focused in that. So you get to learn the new technologies in DNA research that is being published now, and all the new treatments that are coming up. And you are part of this change in the oncology treatment, and you are there for the patients in this moment it can be challenging because it's something that can save their lives, but it can also be difficult, and you're there for them. I feel very honored.
It's an important thing for an oncology nurse to have. I think #1 would be empathy. Just the mere fact that you may not understand what this person is going through, but you can at least try to think, wow, if this was happening to me, how would I want to be treated? What would I like this experience to be like during this time? Aside from, in a general sense, that nursing, it takes a lot of patience. You have to be patient with people because, again, you are dealing with them at the worst time of their lives when they're ill, like it would be for any of us. But I think empathy would probably be the #1 most important.
What I love about being an oncology nurse is making a difference for my patient, being an advocate, being there when they're at their low and their highs, being their cheerleader when they're going through sadness. For example, during COVID times, at the beginning of COVID, there weren't no visitors, so a lot of them were lonely. So I would go in the room and try to cheer them up, talk to them for a while and encourage them.
There's a lot of things I love about being an oncology nurse. First of all, I love the patients. They're not just here for a few days. Sometimes they're here for weeks, months, on and off for years. And you really get to know them and their support system and become part of that support system. So I really value those relationships. Another thing I love about working in oncology are my coworkers. They're amazing people. And I'm not just talking about my fellow nurses. Pharmacy, our doctors here, our nurse practitioners, PCAs, ancillary staff, they go above and beyond for their patients and also for their fellow coworkers. You really get a sense that everyone working here is genuinely invested in our patient outcomes.
The oncology nurses have meant for me as a patient that it's a very welcoming atmosphere. They're extremely professional. They're loving and kind. and they want the best for their patients.